are you?
Hi. Okay. I'll call you back.
So I'm your nurse practitioner, Benny, and I wanted to have a discussion with you about your medication today, and I'd like to know if I could see your identification. Name and date of birth.
Tatiana Garmendia, 12/24/84.
Got it. Perfect. Okay, it verifies. So I just wanted to have a discussion with you about the medication that they wanted to administer today. That's called the Digoxin. Have you taken this medication before?
No, my doctor said it would be a good idea since I have this arrhythmia still.
Okay. Because the Digoxin helps to control the ventricular dysrhythmias and increase the force of myocardial contractibility. In other words, it helps your heart pump better, and it also slows down your heart rate, so your heart doesn't have to work as hard to pump blood to your organs and to your extremities.
Doesn't sound too bad.
I just wanted to notify you about some adverse effects that you might have from this medication. For example, it might cause bradycardia, which means that your heart rate might be less than 60. It may also cause weakness. So when you're doing activities or when you're walking or standing up, I want you to be cautious of how much force you're exerting, and I don't want you to overexhaust yourself. As well as any arrhythmias. So if you feel that your heart rate has dropped drastically, a lot lower than 60, I want you to go to call 911 or go to an emergency department, because this is an emergency. Okay. Also thrombocytopenia, and as well as electrolyte imbalance.
What is thrombocytopenia?
That's a good question. Thrombocytopenia is a term used to identify the low number of platelets that a person has. And if you have low platelets, it means that your blood won't clot as well. So if you cut yourself or something like that. So if you're doing activities that are either intense or sports, or if you are shaving, I think it's best to use an electrical shaver to prevent bleeding. Before administration of the Digoxin, be sure to monitor your pulse. As I said before, it should be no less than 60. If it's less than 60, I do not want you to take this medication, because it could cause heart block or adverse effects in terms of bradycardia. And I also wanted to let you know that when you leave the hospital, we will be giving you the Digoxin that you can take at home, but at home we want you to monitor your own pulse, which I can teach you. Here, let me show. This is your radial pulse, always near the thumb.
Mm-hmm.
So what I want you to do is I want you to take 2 fingers. You can use it with it in a hand. You can feel it. Mm-hmm. And what I want you to do is monitor that for how many beats per minute are there. And if it's less than 60, again, I don't want you to take that medication, okay?
Okay.
While we're here, though, in the hospital, a nurse will be using a stethoscope, and they'll be checking your epical pulse beneath your left breast, near your rib cage, and they're going to see if it's less than 60, and if it's not, again, they won't give you the medication. Let me see something else that I just want to cover here. Before I administer the medication, I just wanted to ask you a couple questions. Is that okay with you? Are you taking any other medications, even including dietary supplements?
Just my vitamins.
Do you have any cultural considerations that you would take into account at this moment when taking the Digoxin?
No, I don't.
Another important thing that I wanted to cover with you is, do you have any problems with incontinence?
What do you mean? Like if I have a problem going to the bathroom?
Yeah, that's exactly what it means. Like, do you have problems, alleviating yourself before you go to the bathroom, or you not making it to the bathroom in time, or do sometimes, when you're in bed, do you alleviate yourself there, and that kind of thing?
No, I don't.
In terms of when to take your medication, I wanted to ask, do you have any preference of what time during the day you would like to take your medication?
No, I take it anytime, I guess.
Okay. Because this medication specifically has to be taken or should be taken every day at the same time. So either you can take it before you go to bed or you can take it in the morning, as long as you take it in the same time every day. As long as another important point to cover is that if you miss a dose, you should not double dose. And if you miss more than 2 doses, I want you to contact me or your other primary care physician.
Okay. I'll probably have to set an alarm for it, but okay.
That's a great idea, actually.
Okay. I'll do that.
I'll be right back. I'm gonna get you digoxin. Okay. So I'm here just checking your medication with your medical record. Digoxin, 0.25 milligrams. Okay. Alright. Can you tell me your date of birth and your name, please, one more time before I administer your medication?
Yeah. Tatiana Garmendia, 12/9/84.
Perfect. And here I have your digoxin, and it's perfect because you have some water by your bedside.
Oh, that's perfect. Thank you.
Thank you. Okay, so I'll be coming back in 15 minutes to check your blood pressure and your heart rate just to make sure that everything is in order. And then I believe that you'll be discharged. I spoke to your primary care and you'll be discharged around 3 o'clock.
Mm-hmm.
And if there's anything else that you need or have questions about, please contact me.
Okay.
And if any of the symptoms that I spoke to you about that you should be alarmed about, please contact 911 or go to the emergency department.
Okay.
Do you have any questions?
No, I think that's good. I got everything.